Hey guys, so today's video is going to be about the opioid epidemic, and my friends at the Now Matters More Foundation did a rundown of President Trump's speech, which gave all of the bullet points basically of what he's going to do to combat the opioid epidemic. And I wanted to give my take on all of the points because drug addiction is a topic that's very close to my heart, as probably all of you know. Some of you might not if you're new to me. My brother struggled with addiction. I know many other people who have struggled, are struggling, are no longer here, just like my brother who committed suicide in 2015. So there was a lot of good news in the president's speech, and I just wanted to go down the list and talk about it. So one of the points that I wanted to make is I hope that everybody kept an open mind, because I know that a lot of people don't like a lot of what the president says, so they tune him out no matter what. And it's been my experience that sometimes the greatest speakers are also the greatest bullshit artists. So, I'm not telling you what to think politically, but just keep that in mind overall. Another thing that I wanted to say is, given that everything has been kind of crazy the last couple of months, it's pretty impressive that 2 months in, we're already seeing action on this issue. A lot of people, when I bring up, or when everybody in general brings up addiction, it's often talked about that an addict doesn't always look like an addict. But I kind of disagree with that, because there are certain physical characteristics that do show themselves that I think if we do want to make this a medical issue, we should talk about. Like, if you have chickenpox as a kid, the doctor's going to look for little red dot pimple things all over you. For addiction, one of the things that they can look at you and see could be dark circles under your eyes, dilated eyes, weight loss or weight gain, and that can go for many other things, but let's rule that out too. If we want to make this a big part of a normal routine for a doctor to actually be educated on and look for, let's look for those specific characteristics, as well as many others. I'm just giving you examples. And you know what? Sometimes there aren't. Sometimes it can be the most quote-unquote clean-cut person and there are no physical symptoms until you actually run tests of inside the body. But I kind of feel like we need to look past badly characterizing and actually realize that it could be a little bit beneficial. So, the first thing that the president talked about is to restrict the 1970s rule that prevents states from providing care at certain facilities with more than 16 beds. This is amazing. I can't tell you how many times my brother would call a place, they were full. Or he would call a place and the waiting list wouldn't take him. And the biggest problem that I have with this is rehab facilities that are much more in tune with addiction than I am should realize that you have a very short window from the time the addict wants to seek help until the next time they want to use. If the answer from you is no, or can you wait, or we'll see, or let me get back to you, chances are the addict's going to go use and change their mind completely. So let's not restrict the beds, get them in when they want the help, and see more success. That's one of the biggest problems that I've always had, is no beds, no rooms, and making the addict wait. And I understand that you have to go through certain logistics and stuff like that, but there has to be some step in between that they can take where the addict is being taken care of in some way initially, so that they don't change their mind. And some will. I completely understand that. Some will. But there has to be something that can be done there. The next point that the president made is to get rid of barriers blocking or in the way of someone getting help, to roll back regulations, for example, allowing repeat patients if they relapse, or making you, like I said, wait on a waiting list, or going all the way there to be denied. That's all just examples, not from him, just from me and from my friends at the Now Matters More Foundation, of what we suspect could be the barriers that the president was talking about. There are so many barriers when it comes to addiction. It's ridiculous. It's so hard to get help, and that should be an issue where it does not matter whether or not you have medical coverage. It does not matter whether or not you are loaded. The fact that somebody does or doesn't have money should not dictate whether or not they get adequate help. Because chances are, when they're ready to get help, they've blown the last of their money or close to it. And I mean, I get that we as the loved ones of addicts really want them to prove themselves and, oh, you didn't have a problem getting high and wasting all that money. So, these are all things that I'm sure many people have said who have a loved one that they've gotten frustrated with. But when you're in the field to actively help, when you have the means to help, those are the first people that should not have money, first of all, in their head. Do something adequate for somebody and get rid of the red tape. I think that's really important. The next point was a presidential commission headed by Chris Christie putting a report together to come up with solutions. Chris Christie is the governor of New Jersey, and he has a hotline for addiction, and he's reached out across state lines to other state officials for help. I've always liked Chris Christie's attack. I don't know much about his policies. I've always liked his personality and his attack on things, and that's very much needed for this. And it's worth it to give him a shot. And if anybody hasn't seen, he made a speech, I forgot where, it seemed like it was at some kind of a dinner, about addiction, and talking exactly what I said before about how we need to treat this as a medical issue. And he talked a lot about the stigma, where you don't judge somebody who dies of cancer for possibly contributing to that the way that you would judge an addict. So we should get somewhere with Christie. The next point is that the federal government is aggressively fighting this problem to stop the supply and demand to have the demand reduced. Physicians will have better practices for safe opioid prescribing. Additional training could be possible on addiction. Um, I personally think that should be mandatory and very in depth. Accountability and liability for doctors. Lawsuits by the Justice Department for any malpractice. Both ends, in the government and physicians, are trained how they're supposed to be. One of the points that was made on the radio show for the Now Matters More Foundation was about the labels. How cigarettes say it can cause death, but opioids and prescription drugs don't. And I think people need to be warned about the dangers, for sure. That it should include a follow-up to make sure problems are being solved and they aren't just becoming addicted. Education on opioids, overprescribing and not following up. And this is actually something I did not know. Alcohol, heroin, cocaine, Marinol, amphetamines were all used in some legitimate medication. Heroin was used as an alternative to morphine. 70% of all heroin users started by misusing prescription drugs. That I kind of had an idea about, but not that percentage. Most psychiatrists don't know about Vivitrol. And Tramadol just got reclassified as a narcotic. These are all medications that people actually need. But a lot of times it can cause more harm than good. Not really defeating a problem if it's just creating another one. And he goes into different methods later on, which I completely agree with. If you know me, I am extremely holistic. I barely take anything for sinuses and allergies. And I think for somebody who is already dependent on something, and could possibly turn into a full-blown addiction and, really harm their insides and, their overall well-being as a person. Definitely, because there's people who just want the problem to go away. They don't set out to become an addict. And I think that would just be great for them. Opana was actually taken off the market. President Trump was talking about it, taking one of the drugs off of the market, and that was the one. I didn't know that a kilo of fentanyl and a kilo of crystal meth can actually kill you. Not the same thing for something like heroin, but that would be something that the wall that a lot of people are against would combat, because not many drugs will come across it. However, you don't necessarily need a lot of a certain drug to kill somebody, or many people. Another point was research, learn new ways, evidence-based practices, proven methods, pursuing integrative methods that are proven. This is amazing. I'm all about researching different ways to do things, because obviously if we still have this problem, we've just been putting a band-aid over it, and we've just been trying to pull something out of our asses, pull something out of a hat to try to fix it, and obviously it's not working. So let's try to figure out a different way. And I know that especially for opioids and for prescription drugs, that can scare a lot of people who have built up a dependence, even just in their minds, that what they're on is working in some capacity, but it's really not working to the best of the ability that it should. I think researching new ways is an amazing idea. I really do. And I really hope that that happens. The National Institute of Health will work with pharmaceutical companies to develop non-addictive painkillers and new treatments for pain, addictions, and overdoses. This could have come from investigating rehab centers that already use holistic methods. Like I said before, we've had the same methods, which is what contributed to addiction in the first place. And regular doctors are often too quick with the pen. They don't often recommend things that aren't going to make them or pharmaceutical companies money, like go for a walk, go do yoga, try meditation, you know, not even anything too woo-woo, but things that would be good for you, like changing your diet. Well, a lot of them do, I have to say. They will recommend changing your diet, even for things non-related to addiction. But other than that, they don't go too holistic, and I'm a holistic freak. So I'm all for that. A prevention, massive advertising campaigns to prevent children from drug using by teaching them what it really does. I don't know if this would be effective, but it's worth it to try. I mean, if terrorists are trying to get at our youth and adolescents by ads, and it's kind of working to convert a lot of people, why not try this for addiction? I mean, how many of us are looking down at some device? I'm looking at two right now. I have my Kindle, and I'm looking at you on my cell phone. That's where to go to prevent it. That's for sure. And I think, personally for me, we need more positive things going on where they don't automatically go for the drug. Because if you are recluse, if you are depressed, you're gonna go possibly for your devices. Let's have more uplifting, maybe apps or things to do. Maybe let's have more, more interactive things around town. More like rec centers or physical health or holistic centers around town to get youth into, so that they don't get stuck on a street corner with the wrong crowd. I mean, and all of this might not work for everybody, but I think it would make a really big difference. And I'm talking a little bit off the cuff here, and this is not all of what he said. These are a lot of my ideas that I'm bouncing around. These are a lot of the Now More Matters More Foundation that they bounced around. But that is actually something that I'm really, really passionate about as far as prevention, because I'm in a wheelchair, and a lot of people with disabilities do suffer from depression, do take a lot of medication, and that's, I think, why I became holistic as passionately as I am, and why I've tried to have a lot of happiness within myself and look for positive things to do, positive people to be around. And I think it would be really beneficial to get people before they start. And I spoke about my brother shortly after he passed away, and one of the other speakers was a kid that was actually a recovering addict himself. He started with prescription drugs at 8 years old. Now, I knew they were starting young, but I did not know that it was that young. I would think like maybe drinking or like sneaking a cigarette at that age. I would never expect that age to start with prescription drugs. It was so sad and scary. It's really become a scary thing, and a lot of the time you think it's just you. I didn't realize, and that's why I'm so passionate to make this video, because a lot of the times you do think it's just you, but to realize how big the problem is, I already wanted to help the families of addicts, and I still do, cope with the addict's addiction, and sometimes even when the addict is sober, you still have catching up to do of your own, and your own life to reclaim. And then especially if the addict passes away. So this is just stuff that I'm really, really passionate about as far as the families as well, because they do need a lot of help. Anyway, I'm done ranting. Differentiating between the person and the addict has always been something that I could see. Like I've always been very perceptive with people, and like I could tell when somebody's using, I could tell when somebody's just a horrible person and they're not an addict at all. But I think it's very, very important, especially in the recovery process or right before the recovery process, because you want that person back. You want to reclaim that bond and that relationship in your life that you once had. That person is still there until their last breath. I'm convinced. And it's so important to not lose hope and faith in that. And when you can get into a place after you've lost somebody to realize that, like I knew it before, but to still be able to say it means a lot, because there's a lot of people who are bitter and angry and resentful when somebody else gets help that their loved one couldn't because they're no longer here. And it's my mission that everybody gets the help that they need. Oh, and by the way, I will be leaving all the information for the Now Matters More Foundation at the end of this video in the description. Because if you do need help, or if your loved one needs help, they're the people to go to. Melania is actually a big part of this. She spoke before the president about this issue, and she really wants to help new mothers and addicted babies. And holding addicted babies is something that I've always wanted to do. I love babies in general, but the closest, I don't know if it's a hospital or a center that does that, is quite a few counties away from me. So I haven't been able to do that. But newly born babies and addicted babies, they really need a lot of care, especially if their parents are not yet well and they're getting their own help. They need as much love as they can get. So that's definitely something that's really important. The next point was drug courts, helping inmates to get treatment and integrate back to their normal environment after their release. President Obama started this. Trump is continuing it. Very important. I can't tell you how many times I've had a loved one end up in jail. Yeah, they can detox, but that's pretty much about it. They can get, like, whatever medication they were prescribed for their other problems, like anxiety, depression, or whatever they were prescribed, but very rarely do they get hands-on help as if it was like a rehab, which is very important. And I think once upon your release from when you do your time for whatever crime you committed, I think you should automatically have to seek help. And I know that's kind of like forcing it, but if you keep them there long enough, maybe they'll warm up to it. That's my hope. That's just my opinion. Adopt common sense solutions for prevention, which is what we already talked about, and I'm very, very passionate about it. 2 points. The president has already allocated $1 billion for grants, and he's allocating $81 million in partnerships towards pain management, which, like I said before, with holistics, I think that doing things holistically, and for anybody who gets scared, like I was talking about before, I think maybe if you're watching this and you're worried about becoming addicted to opiates, or you don't really want to take your medicine but you don't want to go completely off, because you don't want to go through withdrawals or whatever, I would recommend integrating something holistic with what you're already doing. That way, it just feels safer to me to do it that way. I don't know, it feels a lot safer. And I mean, you can't go wrong with integrating something good for you and healthy for you, regardless of what else you're doing right now. Excuse me. So that's basically what I wanted to say. I'm very, very excited about this. I really hope that this is something that we can put partisanship completely aside for it and not just be like, ew, I don't like the president right now, so screw this. I'm not gonna even look at it. I'm not even gonna give it a second thought. Let's get a little real here. You know, regardless of what I've thought about past presidents, and regardless of what anybody will say that I've said, there are times when, if the person is in office long enough, they're gonna do things that could surprise you in a good way. And if it's something close to your heart, I know people don't like when I say that because, oh, we should always care about things that don't directly affect us, but when it does, I'm sorry, the issue is what matters. I'm not a one-issue voter. I don't make any claims to be. But this issue in particular is extremely important to me, and I am behind this 100%. And I don't think we should leave it just up to the government. We should take some of these ideas, do it in our communities, talk about it like this. Talk about it in live videos. I haven't really done much live yet. But I want to get involved in any way that I can. And if you want to get involved or contribute in any way, my birthday is next weekend, this coming weekend actually, because today's Tuesday. My birthday is this weekend, and I am asking everybody to donate to the Now Matters More Foundation for my birthday to help an addict that cannot afford to get help, the gift of help, basically. And it's a completely reputable foundation. I love the people who run it. I'm friends with them. And they've helped me a lot with my brother's addiction. And like I said, if you're watching this and you've lost somebody, you still need to take care of yourself. Because you are still, especially if you've lost somebody when they were active in their addiction, you're still sick with their addiction. You could be, I'll say. You still could be. And it's a shock to the system, because a lot of the time we don't completely grasp the fact that they were even an addict, and we don't know everything we could potentially know about the addiction itself before they're taken. And then we have to go through the grieving process. So you kind of grieve twice. So definitely, you can reach out to me as the loved one of an addict if you need to talk. You can reach out to the Now Matters More Foundation if you want to talk about, getting help. They're also great if you are the loved one of an addict, just to talk to them too. I do, ad nauseum. But, yeah, that's pretty much all I wanted to say. So look for me to get involved with this. If there's any other topics on addiction that you would like my thoughts on, my experience with, my opinion on, please don't hesitate to ask. I definitely want to make more of these types of videos. Subscribe to this channel because I will definitely be making more videos, at least once a week. And that's it. I'll talk to you guys soon. If you've made it to this point, it's about 30 minutes in, thank you very much, and please share this with somebody that you think can benefit from it.